Hi, this is Dr. Christopher Maloney, Naturopathic Doctor in Augusta, Maine. I wanted to talk to you about estrogen replacement therapy. Now, back in the early 2000s, estrogen replacement therapy was the best thing for women since sliced bread. We then had the Women's Health Initiative that has, in a sense, shown that estrogen replacement therapy is terribly dysfunctional for the human body. It actually leads to an increase in a variety of diseases. In fact, at this point, the only long-term reason to take estrogen replacement therapy is for bone loss. There is some benefit for bone loss, but otherwise, across the board, estrogen replacement therapy is supposed to be a temporary measure at this point for the use of hot flashes, and that's it. And the problem I have with that is not that women should have hot flashes, it is that there's a whole variety of other things you can do that are less intrusive than estrogen replacement therapy and also don't add to the risk of that woman getting a variety, the side effects from estrogen replacement therapy. So when we start talking about hormones in the body, what's left out often is the fact that if you're not excreting anything, you're not going to have balanced hormones. So if you don't go to the bathroom for 3, 4, 5 days, number 2, chances are things are backing up in the liver. You're going to have some level of imbalance. Many women are able to handle that because they have lots and lots of estrogen, so a little bit of a variation doesn't cause a problem. But there are other women who are going to experience they have very little estrogen, so a tiny variation in their estrogen is a very poor thing for them. So something as simple as going to the bathroom every day can affect what's happening. Exercising makes a huge difference because you're pumping all the hormones throughout the body in a much greater rate. So exercising or not exercising on a given day. Say you go on a marathon run every weekend and then sit on your desk all week. That's a very poor idea because you've given the body an enormous amount of estrogen, like mobility, and then you have almost none. And so the body is just like, well, what happened? I thought we had this much estrogen, we don't. So it's more likely to set you up with hot flashes. At this point, hot flashes are still not understood. We have to be really clear about that. They say, well, it's an estrogen peak. My answer is, well, wait, when we do the studies, when we do the blood draw on somebody, and you see that the estrogen hasn't peaked at that moment, even though she was having a hot flash, isn't that kind of definitively that's not what's happening? The most recent material I saw was a kind of hypothetical idea that maybe it was testosterone. Basically, women have estrogen and testosterone, men have testosterone and estrogen. They're in different balances, but if your estrogen is really far off, you could have the little tiny amount of testosterone that you've got in there could actually be free range and actually end up affecting your thermostats in here and set you off for a hot flash. And the idea there is that you've got so much sex hormone binding globulin in your liver, it's like a truck that carries around 99.99% of your estrogen or testosterone through the body bound, so it doesn't actually affect your cells. But all you need is the 0.1% that have that level, that hormone can come free, and that's enough to actually really actively affect the body. So if we're looking at that as a possibility, one of the most recent things I've been working with patients on is a thing called GABA. GABA-aminobutyric acid is a substance that's normally created in the gut. Normal gut flora will generate that, but it can be off, especially if you have estrogen imbalance. What happens is estrogen imbalance leads to pH imbalance. pH imbalance leads to different growths of different things. So you might notice, hey, right before my period, I always get a yeast infection. And that's because the pH in the vaginal wall has actually changed. But during the perimenopausal years, your pH in your gut can actually alter, and you can actually set yourself up for the growth of different new bacteria, enough that you could actually affect the amount of GABA that you're getting in your body. And GABA, when I'm working with GABA, it's actually very useful for a variety of other uses. But in this case, it actually seems to help a lot with some people's hot flashes. Other people, not so much. Again, it's a matter of how much levels you've got on the basis. The other one we have that's very common is black cohosh. Now, black cohosh, let's be clear, when you're buying something over the counter, chances are it can vary by as much as 250 times in terms of how active the ingredients are. So when you see the cohosh studies, you say, well, wait a second, this is this one says it works, this one says it doesn't work. I'm like, they're both right. That brand doesn't work, this brand may work. Again, the black cohosh isn't specific estrogen, it doesn't work on the estrogen receptors in the body. It actually goes up to the pituitary and the hypothalamus and affects them. And the biggest background for that is that unlike estrogen replacement therapy, black cohosh does have some, the whole cohosh, the whole herb has about 8 different antioxidants that help prevent breast cancer, whereas the estrogen replacement therapy actually promotes breast cancer. So the black cohosh as an alternative is better if it works. And the trouble there is, again, I've seen people take black cohosh, half a capsule a day, totally fine. Other people, 5, 6 capsules, nothing happened. The body is just not using that cohosh to do what it needs to do. I should also, this is a good time to talk about, a lot of my colleagues are using, and I'll use to some degree, naturally derived estrogen, which is basically human equivalent estrogen or progesterone. And the trouble with that is they're still talking about estrogen and progesterone, and I would say, well, it's better than estrogen or progesterone probably derived from animal sources. I believe that the Premarin is actually from a pregnant mare's urine, and it's been extracted and synthesized from horse. But it's not specifically for human beings, whereas this stuff is supposed to be for human beings, but we're still giving hormones. And in a person for whom there's a lot of hormonal variation in their own body all the time, that's not going to be a problem. But for the person with a little bit of hormonal variation, and you're suddenly giving them even this much naturally derived hormone, it's a bad idea. It seems like long term that person's going to be at an increased risk factor. And so I apologize to my colleagues who are all really into this. I'm like, guys, this is the reality. They're going to have people up here, that's no problem, and there's people here that's going to be an issue. One of the things then it becomes, those people here, this range, you say, well, what about diet? I'm like, well, soy is a phytoestrogens. Now, I know a lot of people, there's a lot of alternative stuff. Oh, soy is bad because it's a GMO, and it's all, I'm like, you can get non-GMO soy. And the issue here is you're talking about a woman who's either going to take hormones to prevent her hot flashes, or she's going to take soy. And in that case, and if we're looking at that choice, I'd say soy is a far less toxic substance long term. And so soy is actually phytoestrogens, and they'll go in and they'll balance out your estrogen. So if you've got a lot of estrogen on a given day, they'll take it down, they'll compete with it. If there's not enough estrogen, they actually will modify and increase the estrogen factor. And that's why soy is under exploration for breast cancer, because if women who have no estrogen at all, and you're taking a whole bunch of soy, take 5, 6, 8 servings a day, it's not a good idea, because you're actually increasing your estrogen factors, you're increasing your breast cancer growth. That's a bad plan. But for someone in the middle range, or someone who's having estrogen going like this already, it makes much more sense to have a little bit of soy. Try soy for a week or two, see if it doesn't help with the hot flashes. The second thing there, if you're doing soy, you need to look at alcohol. Now alcohol, if you and I drink alcohol, it goes into our system, it takes a priority over everything else to be processed. So when it takes a priority over everything else to be processed, what it means is that for about 2 to 4 hours, your estrogen levels are not where they would be. They would actually be elevating because they're not being processed by the liver. So within 2 hours, you can see as much as a 300% increase in estrogen in the human body. So I've had patients come in and they say, well, I just drink twice a week. I'm like, don't do that. Don't drink twice a week. Don't drink a whole bunch of alcohol twice a week. You've just spiked your estrogen twice a week. That's not a good idea. I'm not saying you can't drink. I'm saying you need to really modify that, because alcohol is going to definitely throw off that estrogen level. The other one is red meat. Red meat is from male cows. Officially, we are not affected by male cows, but sorry guys, we actually are. What happens is within 2 hours of eating a big steak, you can see an increase, not as much, but an increase of about 20% in testosterone levels. And so if you're looking at hot flashes possibly being testosterone related, eating a ton of red meat is worth checking out in terms of, okay, does this affect me? Am I getting more hot flashes within a day of taking that? What's going on? So I'm not saying don't ever eat red meat. I'm not saying don't ever drink. I'm saying you need to really take those things into account, especially if you're somebody who has this very tight range of hormones. We've got, dairy. Right, dairy. Dairy's cow estrogen, right? Because they're pregnant cows that have just given off estrogen. So officially there's no effect. Suspiciously, those hormones still need processing in the body. How about that? We'll just back it off and say, no problems with dairy officially, but you've got cow hormones coming through. Is that going to be a factor with your own hormones? Well, they have to be processed by the liver, who's going to use the same mechanism to process those hormones as they would your own. So I'm not going any further with dairy. I'm just saying, hey, have a look at that. If your hot flashes are worse, drinking a lot of dairy, that might be a factor. Teas, we've got teas, raspberry tea, the female teas. A lot of these herbs come in tea form, but raspberry is a very nice tea to take because it's really non-toxic, and you can eat it as a food. You're really doing well, and you can give it to pregnant women, and it actually seems to help and to support the balance of things. So that's it. I want somebody to do detoxification and brown rice diets and things like that. There's a whole bunch of things you can do that are more intrusive to help balance your estrogen. Most people won't do them, so I won't go into them in detail right now, but there's a whole range of things. I had patients who had terrible hot flashes and resolved them, but they did some very intense lifestyle changes. And so it's very possible to alter your hot flash range without taking estrogen replacement therapy. So this is Dr. Christopher Maloney talking about estrogen replacement therapy. Thank you for listening.